Tonight with an important reminder about breast cancer. It's the second most common cancer in women, and this year alone, more than 42,000 women are expected to die from the disease. That's according to the American Cancer Society. Early detection is crucial, and a breast cancer risk assessment can help guide women on when to start screening. But how does it work? Good question. When it comes to breast cancer detection, there's no one-size-fits-all approach.
Individualized care should be involved when it comes to breast screening and breast care. And that means that everybody's going to have a different screening protocol based on their personal and family history.
That's where breast cancer risk assessments come in. These assessments help measure a patient's risk of developing breast cancer using tools like surveys, either online or in a doctor's office. Your risk is calculated based on several factors like age, family history, personal medical history, race and ethnicity, breast density, and hormone exposure. The results of this assessment will determine when a woman should begin screening.
Most average women should start annual mammograms at age 40. Some women should start screening sooner based, again, on that personal and their family history.
Now, some doctors even recommend getting assessed at 25, especially when there's a family history of breast cancer. For those who don't know that history, genetic testing can help.
We rely on our genetic counselors who can do a pedigree to the degree that we know about family history, and then do testing to see if you do carry a genetic mutation that increases one risk of breast or other cancers.
Knowing your risk is important, but doctors also say maintaining a healthy diet, staying active, and limiting alcohol can help reduce your chances. Well, coming up.